Hello class, in this video I will give a preview of Chapter 3, Paying for Health Services here in the United States. To start off, the chapter talks about healthcare financing as a mix of public and privately funded funds. And then it'll shift to reimbursement for healthcare services. So the history has been a shift from fee-for-service, which is basically paying by service received, to an attempt to reduce costs and improve care through capitation, accountable care organizations, and other developments such as those. Then it'll shift to government programs such as Medicaid and Medicare. Medicaid is typically known as a program for low-income individuals. And there have been changes recently through the Affordable Care Act on who is included in that population. And then Medicare, which is typically for older adults as well as people with disabilities. So after that, the chapter will shift to the history of health insurance in the first place in the United States. So you'll read a little bit about how it started off being employer-based, and now we have the system that we have because of the history that we've gone through. So this is a different model than those across the globe. You'll see that in many other developed countries, healthcare is available to everyone regardless of their employment status. And so you'll read a little bit about why the insurance model is the way that it is now. The chapter will also cover managed care. So HMO, PPO, and EPO, these are common terms that you'll hear in the healthcare industry, but perhaps you may not be familiar with those. Essentially, it's the different ways that you can receive care. So whether your providers are in network or out of network, and all that really means is whether your insurance is going to cover the people in a particular contract group that they've negotiated with or not. Then it'll talk a little bit about private health insurance. So there are some common terms such as premium, deductible, co-payments, out-of-pocket. All of these things will be covered in a little bit more detail with the Kaiser Family Foundation videos. And then healthcare expenditures. What are the percentages of funds being covered in certain areas? So it's helpful to know this as folks going into the health industry, not just so you know how you might be receiving funds as a practitioner, but also so you're familiar with on a national level, the issues of funding and rising healthcare costs. And that's about it for Chapter 3.